Hello, Dr. Reham Farouk. Hello, my colleagues. I'm Mostafa Nabil from Consumer Behavior course, intake 63H. Now I'm going to present my individual project. The topic of my project is the consumer behavior in aesthetic medicine applications. Hope my presentation become useful and interesting. Let's start. Okay, the consumer experience of aesthetic medicine services. The introduction of this presentation. First pillar is the new era and changes and it challenges. What is the new era? In the last 20 years, the anti-aging aesthetic medicine concept imposed its presence in the cosmetology market. The need arises obviously between females and males for different motives. The interest in cosmetics and anti-aging therapy increases day after day, particularly between females as her nature and perception push her toward the beauty and feeling beautiful. The challenges in that, the marketeer will face a lot of challenges according to the high competition that indeed will affect the consumer behavior and how sophisticated the consumer now become. The second pillar in my introduction is talking about the aesthetic medicine concept, just to make sure that you all know what we are talking about in this presentation. When you are using the term aesthetic medicine, we are talking about the fine intervention in the face or the body of the patient without any major surgeries. It's 15 to 20 minutes procedures. Examples of that is the Botox injection, filler injection, different types of peeling or mesotherapy, also the lifting threads. All these products are used wide range in the aesthetic medicine. Okay, last pillar is what is the purpose of the papers summarization, of these papers summarization. Actually, I summarized two researches, both of them in Europe, one in Italy and the other one in Slovenia. I found that these papers are very useful and directly connected to the consumer behavior courses that we are all studied already in the previous 2 months. So the purpose is to illustrate and clarify how the consumer, how the marketeer should see the consumer behavior and analyze this to upgrade and to reach his objectives and upgrade his visions and his tactics and strategies towards the cosmetics market. Here I talked about many elements that is related directly to the consumer behavior course that we studied. First one is the way the consumer determines his or her need for aesthetic medicine. There are three major motives that push the patient towards the clinic or towards the cosmetic practitioner. The first one is a physiological problem. If the patient is suffering from any physiological problem, he will of course seek the good and professional practitioner, maybe dermatologist or maybe a plastic surgeon, to correct and to take the proper therapy for his problem. Second reason or second motive is the better me idea. The better me idea, it means that in everyone imagination, we all have the ideal me. So they are going to the cosmetology cosmetologist to to make this come true. They make the corrections and contouring, and sometimes huge change in their face or body, just to reach their dream. They want to reach the ideal image of them. The last one is the trend. Let me differentiate between the second and third type. The second type sometimes, or most of time, related to the aging process and the aging signs that may take place or appear in the face, like wrinkles or sagging skin, flaccidity, or sometimes a hair fall. But the trend in shape not necessarily related to that, to the aging. No, it may be related to an icon celebrity that I'm following and I admire. This celebrity inspires me, and I want to make to make the shape like my cheeks shape like him or like hair. I want to be attractive. I find that this celebrity gain the admiration from his shape, and I like to be like him. Sometimes it's not related to a celebrity or a model person. No, it's sometimes related to a trend. Like nowadays, there's a trend in cat eyes. So I find the clinics, all most of the females now are asking in the clinics and also in the social media, asking about how to make these cat eyes, how to and where to go, who is the best dermatologist or plastic surgeon that is professional enough to make this cat eye look. If you look at the table in front of us, the correction of physical defect um, represent about 66% of the motives. Second one is 24 related to the aging or signs of aging, and the third one that sudden change or a need to want to change, not related to a problem, is about 9%. Okay, when you talk about the source of information, the most used source of information is the internet. Of course, you are in the digital era, and all are using internet and mobiles and laptop. Internet is everywhere. There is no doubt that the digital revolution has also affected this sector. It comes first as a source of information. Second source is the friends and the relatives. I mean here the word of mouth. When you find your friends or relatives or family, any family member, sometimes your daughter or your son made kind of change in his shape, you find that a positive change, so you start asking and you start looking for the information and then you are going to make sometimes a similar change or other change you already need. Third source of information is the clinic or doctor himself. As we can see, in this field of cosmetics, the competition is very high, and the doctors now are depending on marketing externally and also internally in the clinic. So they encourage the patients to make different procedures. If the patient is coming to make laser therapy, they are trying to persuade her make another procedures. Sometimes it's Botox, sometimes it's filler. So the clinic itself is a source of information. Last source of information is the newspapers or advertising journals, and it's mainly for older patients collecting news from this source, where younger people prefer to turn to the web. Okay, let's move to the third element, the factors influencing the buying decision. Actually, the patient weights her decision, if we are talking about females mainly, by evaluating the medical service proposal. Females are focusing mainly on rating the fundamental service that she is seeking, in addition to all the personnel in the medical center. She evaluates everyone. She evaluates every step, starting from the pre-purchasing uh, uh, pre-purchasing steps until she takes the service, and also post-purchasing. She evaluates the environment, the equipment, how updated the equipment is, or sorry, are, variety of services, the stuff. But let me clarify something. The variety of service, not that huge interest, because sometimes the specialized service um, reflect more confidence for the patient to go to this doctor who is specialized in a certain service. The professionalism of doctor, not only in the procedure but also um, in the relation with the patient, in the attitude. The opening hours of the clinic affects the choice, because the working women may find difficulty in certain hours, or also the women in when they have a large number of family members, they also find difficulties. Imagine yourself have four or three or five children in the schools, and you want to take care of them. It's very difficult for you to go to any clinic just in certain hours, sometimes in weekends. Also the price and first visit and free trials. Fourth pillar is time for seeking the service. It varies from the purpose of the service. If you are talking about the sudden change, I mean, someone or someone wants to follow a trend, or as I said before, wants to make a change in his, or sorry, in her cheeks or lips, not for a physiological reason or aging reason, but she wants to make a change to feel better. That may take 2 weeks to decide, and to decide, and to already finish the service, or acquire the service. People who need the physical change in face or body may take a longer time due to a lot of thinking, and they sometimes may feel afraid or hesitated towards this service. Okay, determination of the satisfaction degree. Here we are talking about the core service, which is um, the beautification of the face or body, or maybe both. But also the supplementary service, here is are playing a very important role. As I said, the sophisticated patient nowadays are looking for the perfection, and looking for the comfortable and luxurious service. Um, yes, they vary from the social, according to the social level and the age. That all segmentations factors affect this satisfaction. But also we are talking generally about the aspects and the reasons or points that affect satisfaction degree. This table illustrates the satisfaction degree aspects, like professionalism of the experts, attention to the need, comfortable environment, and according to the age class. Finally, we're going to discuss briefly the attitude formation or change towards the aesthetic service provider. In this point, we could talk a lot about the attitude formation and change, but I summarize the idea and what's happening already, and that the attitudes mainly are being affected by the geographic and the demographic impacts. There are many variables affecting the female's attitude towards the aesthetic service. For example, the women that live in a city would potentially more likely consider the possibility of the aesthetic service than women live outside the city. Also, the students has statistically significant more favorable attitude towards aesthetic service than employed women. So the attitude varies from one to another according to the geographic and demographic impact. Thank you, and hope this presentation is interesting. Thanks, Dr. Ham, for your effort and your valuable course. Thanks, my colleagues, and goodbye.